Welcome everybody to the Total Therapy Training Podcast, where you accompany me on my very own journey through traditional Chinese medicine. It is the intention with this podcast to raise people's awareness of how traditional Chinese medicine can benefit us in our physical and mental well-being. We hope you enjoy the show. Welcome, Chris, to this all-new podcast, the Total Therapy Podcast, where the listeners can join me on my one-woman journey, learning all about traditional Chinese medicine. Chris, thank you so much for joining us today. How are you?
I'm very good, thanks. Thank you.
Excellent. Now, Chris, you, amongst other things, you actually facilitate the trainers and the training groups that are ran at Total Therapy. So it makes sense for us to start with you initially and delve into what traditional Chinese medicine is. So then, Chris, tell us, what is traditional Chinese medicine?
Okay, so traditional Chinese medicine, really, if you go back up to 3,000 years, really, you can trace it back, its history, and even possibly before that. Chinese medicine is observation, really, of things and balances and imbalances in the body, and they're trying to understand the medical workings of the body, but from an energetic point of view rather than from an anatomical Western point of view that we've gone in on. And I think because the writing in China was very good and records were kept for very long periods and looked after and respected, I think that things have been passed down and great amounts of observations were made. And really, people think that Chinese medicine is sort of an add-on thing or, some holistic idea. But really, it was the main course of medicine for the whole of China and potentially still is today, going back, at least 2,000 to 3,000 years. So that's what you would, where you would go to be fixed is a Chinese doctor who was doing Chinese medicine. And that could consist of really, these days it's classed into three areas: Tuina, so medical massage, or herbs and herbal medicine, which is more internal, of course, and then acupuncture or other adjuncts to that, cupping, gua sha, other things that people might have heard of. And those three areas, really. So they would make up really the majority of Chinese medicine, although there are lots of other smaller things around that.
Right. Okay. Lots of things I want to ask, but so what can traditional Chinese medicine be used for then? You said basically that this is how they treat people in China. So would they not have any synthetic drugs or anything like that? What can it be used for?
Well, these days, obviously, the hospitals are updated and very much modern. So that when you go into the hospital, they have both wings, both sides, if you want. So if you've broken your arm, obviously that needs physical intervention. So you need to go and see what traditionally was a bone setter, or someone who sets your bones in the correct position. So you go and see a bone setter, which is still a Chinese art, but obviously a modern one as well these days, because we do that in modern hospitals. And obviously you probably have a cast or some other way of limiting the movement of the joint so it can be repaired. But later on, once it's repaired, obviously the joint and the muscles and the tendons haven't been used for a few weeks. You may then be referred to the more Eastern side or the Chinese side of the medicine for herbs, for acupuncture and other things to build back up that joint, to remove any what they would cause blockages or issues that where the energy or the tissues and blood and fluids aren't running properly, and to try and bring that back to normal. So these days there are both sides, and I think when you look at Western drugs, you have to appreciate that Western drugs don't really resolve an issue a lot of the time. If you go to your doctor and they say, right, we're going to put you on this, it usually means they're going to put you on that a lot of the time for a long period of time, and that you're going to get worse. It's not a cure. You're not resolving the situation. It will get worse, and you will need other drugs as you go along and as you decline down this process. So the medicine isn't resolving an issue, and a lot of the time, unfortunately, in the West, we're chasing symptoms rather than the causes. And Chinese medicine really wants to look at the actual cause of the imbalance or the issue in the first place and try and resolve that. And that's really what Chinese medicine is very good at, is getting to the very cause and ignoring the symptoms. So when I was in China, they told me not to ask questions of clients and told me off for it. And I said, well, why not? And they said, well, because they lie. And I said, what do you mean? He said, well, because they tell you the symptoms and they put you off on the wrong path. and rather than looking for the cause, if you look for the causes, and I think you can do a bit of both. There are some clues. If clients tell you that, you ask them about their lifestyle and issues, how they sleep, it might tell you certain things. When you wake up in the night, you might wake up at a certain corresponding time that has a correspondence in Chinese medicine to an organ time, and therefore you might say that's a liver issue because I'm waking up at perhaps a certain correct time. There are other things like if people have a lot of cold foods, cold drinks, and especially if they're wearing sort of shorts in winter and things, as you see some people do, you're obviously trying to cool the body down. There's too much heat in there. So looking at lifestyle issues, I think you can ask the client, and there were 10 sort of key areas that they do ask in Chinese medicine. But really, you're after the cause. The client will generally tell you symptoms, which might give you a few clues, but can be misleading as well. So I think with Chinese medicine, you're trying to get to the cause all the way through with very deep internal medicine. But it could be used for lifestyle issues. People can't sleep a little bit, or they're just feeling up quite themselves. So not serious things. And obviously, most people that walk in our clinics, the fact that they walk in and don't come in a stretcher shows that we're probably dealing with those sort of lifestyle issues more. And then musculoskeletal is the third sort of section you would perhaps look at. People do sports, gym, and pull all sorts of injuries, or pull their back when the posture's not bad, and eventually it might go on them. So there's those sort of three areas, and I think really one that we don't see enough of, or people don't appreciate enough, is that Chinese medicine is deep internal medicine. It does change the balance of the organs. But the problem a lot of the time, I think, is the lack of the language that's used even to this day. Is a couple of thousand years ago, and that confuses the situation, because if I use Old English from 2,000 years ago, people go, "What do you want about this?" So I think we do need to update the language. I think it's the language that's the issue, and the fact that it's in the culture as well, very deeply in the language. You can talk about the weather and say it's yin or yang and things like that. It's embedded in the culture. And so you bring it back across the West, it doesn't quite translate. And I think if you look at, organs can be hyper or hypo. They can be running too quickly or too slowly, potentially. That could be a yang. You could argue yang speeds things up and makes things work quicker, and yin slows things down and makes things, withdraw, move slowly, etc. So I think some of the language you can translate directly into modern medicine, and when you're talking about the yin and yang of an organ, you talk about whether it's running too fast or slow. And I think that's where a lot of confusion comes in, and therefore Chinese medicine doesn't quite get the appreciation that it really is doing internal, deep medicine if you need it, or, as I say, lifestyle issues or musculoskeletal.
What's really interesting about what you said there was that you said that clients lie, right? So if I was to walk in and say to you, "Oh, I've got this bad back, but I sleep really well, I work out, my posture's great," how would you then work out what my problem was? If I was lying to you, how would you work it out?
Well, obviously, clients aren't really lying, but they are telling you information that doesn't really help you a lot of the time. It may give some clues, but it can lead you down the wrong path as well. Because again, you're not worried. Like, for instance, if someone comes in with asthma could be, and most doctors would say, it's a lung issue and it's related to the lungs and there's a problem there. Chinese medicine would say, well, possibly the cause and the symptom is in the same organ. It could be the lung. But also there's a relationship between the kidney and the lung, which is now becoming quite scientific. People are recognizing this now in science, that there's these relationships, and the kidney does support the lung. So if the kidney is working very badly and is weak and has got weak over time, then you'll find that there are lung deficiencies or lung issues as well that start appearing, and then people get asthma. So you have to find the original cause internally, and also you have to look at the original cause externally, because all internal medicine, although you can resolve huge issues very quickly, kidney failure, liver failure, you can do very clever things with it. You have to understand that you were born with a body that's worth billions of dollars, can't be replaced, and that it's born pretty much perfect unless you have genetic issues. So therefore, most of your problems in life come from external influence, and they're probably one of 4 or 5 issues. So you could have the Chinese look at the air, and now the air is not a major one to you. You get energy from the air itself, but the air, if you're in toxic air, that could be really bad for you for long periods. Your diet, of course, will play a huge part in that. Emotions is another large one in life that people are now starting to recognize really could be a lot of cause of disease. You've then got stress, and you've got general lifestyle issues that you have to look at. And they're really the 5 key areas. There were some others like external pathogens. You could catch something off someone, or catch a cold in winter or flu or something like that. So there are some others, but they're the ones that perhaps you're in control of that you have to look at. So Chinese medicine wants to find the internal cause, but also find the external, because then we can try and change the client's lifestyle so that doesn't happen again. Because if you keep repeating the same thing, you're going to get the same result. So, we need to change that somewhere. And really, as healers, we'd like to think we heal the body because our egos are a little bit out there, but really, we don't heal anything. The body heals itself, but it gets a little bit stuck. And it's stuck either because of an external issue that constantly is bombarding it, which we might be able to change, or it's stuck in the healing process. And the idea of all healers is to get change. And I think when you take that idea on board, that all you need to do is change the stuck circumstance or the way that the body's working, the body will then heal the rest. And therefore you can heal huge things. Someone walks in with some bad issue. I think some healers think, well, I couldn't fix that. You're not there to fix it. You're there to create change, and that's it. And if you realize that's all you have to do, you can really change a lot. So hopefully that answers the question.
Yeah, wow. Because like you say, with Chinese medicine, you're not treating the symptoms, you're looking for the root cause, aren't you? And I know in Western medicine, like you just said, they just give us tablets, and then as time goes on, it gets worse, so we need to take something else. So I suppose with Chinese medicine, you get into the problem faster than what you are in the Western world.
Yeah, I think you could treat the symptoms. If the symptoms are really bad for a client, then you need to treat them. I think one of the symptoms that you see a lot is if you don't sleep, I don't think you heal very well. Various processes kick in at night, especially with the liver and cleaning the blood and looking after the blood. And if you're not sleeping well, those processes don't kick in. And I don't think you can heal unless you sleep well. So you might argue, well, that's a symptom, but actually it's one that if you don't perhaps treat, you're not going to get good healing. So I think you can treat the symptoms and potentially the cause and the external cause by speaking to the client and trying to change their lifestyle or the habit or find the issue that's causing it. But obviously, as you say, if you go to the sort of Western doctor, you'll generally get a tablet to try and deal with a certain type of medication, to give you medication to deal with this sort of problem. And they're looking at the symptom. If you go and say, I've got a headache, they'll give me a tablet for my headache. But why do I keep getting headaches is the problem. We need to look deeper and say, well, what's the cause of this? The tablets are really, there's nothing wrong with giving somebody medication at all. I'm not against medication. Some of the medications are brilliant. But it needs to be a short-term issue. So, if you catch a virus and you actually have to have medication for the virus, it's going to kill it off. Well, what a great solution. It helps quicker rather than you fighting it. And if you're a more vulnerable person on a greater risk, then why would you not have that? But I think that when you're on medications for 20, 30 years and you've got lots of medications, in America, it's standard to take 30 to 40 tablets a day is pretty much, a lot. Yeah, absolutely. 20 tablets there is you're on quite low amounts. And you have to understand that 2/3 of those tablets are to counter the side effects of the first third. And that's the problem, that when you mix, not just Western medicines, but even in Chinese herbal medicine, which is it takes a long time to learn, by putting in another medication, you alter the first medication. And so you have to try and balance these very cleverly. And it can be hard work. People, of course, change doctors as well, and doctors are rushed and don't always look at have the time to look at what's happened previously. And so you end up with people on lots of medications that really perhaps are conflicting or causing issues in the body. But again, I think we need to get back to looking at the cause, because doctors go into medicine because they really want to help. But I think a lot of general GPs certainly are just passing people down the road. They're either putting you on medication or they're passing you to a specialist to review. They are good at looking for deep disease, an issue with deep disease, but not particularly good with musculoskeletal because the training's not there, not very good with diet and other things and lifestyle things, where they might see some of the true external causes coming in and could advise the client to change. But the training there, certainly, if you look at food training in sort of the 6 to 7 years worth of training that doctors have, it's about 12 hours long generally. So it's not, there's no in-depth analysis of foods and what they can do. And that's a bit of a shame, really, because that's one of the key things, that if diet's wrong over time, that's going to cause you issue, because most medications come from things that are natural in life. If you look at aspirin, it comes from willow tree and things like that. That's how we all started off. General herbal drugs are from foods. They're just a very strong version of them, so they have a very quick, powerful effect. But if you're having a weaker food, but you're having it 20 times a week, that's not particularly good for you, it's going to have that effect of taking a toxic drug that is trying to actually do damage to you. And so you have to look at the food and say, well, when I eat this, it's like taking a tablet, but it's not a good tablet, it's a poisonous tablet, And if you had a little watch on your arm that told you how long you had left to live, and you had something that was bad for you, and you lost 10 seconds or a minute off your time clock, you'd soon stop eating the things that were wrong, and you soon click into, actually, I'm going to eat foods that actually add 30 seconds to my life rather than removing. So, it would be easy that way. And a bit, obviously, you'd see the benefits very quickly there.
Yeah. Oh my God. It's like, I'm just learning how everything is connected, and I would never have guessed it, before learning about traditional Chinese medicine. You kind of said it, but I'm going to ask it anyway. But
sure.
How can traditional Chinese medicine benefit us then?
I think if we look at musculoskeletal, like you mentioned before, you've got a back issue. Obviously, if you pull your back, I think, things like acupuncture, obviously deep massage can help relax muscles. Usually when you have a spasm, it will generally lock up, especially if you start doing lifting things outside a good range of motion. Your spine could be threatened with the angles that it's going at and the strength of it. And so your muscles will lock up to protect the spine and probably get a little bit torn while they're doing it. So acupuncture, just on a very basic level, and there's lots of papers behind this. This is sort of unquestionable science now. It's so proven that when you put a needle in somebody, you have a very sharp increase in blood supply to that area. And the key thing for healing is oxygen. Without that, all processes for healing don't take place. So if you can increase blood supply, you can increase oxygen to that area, and ideally you can get a relaxation of that muscle, an extension back to normal length of that muscle. And so hopefully by relaxing it, you'll let go of the nerve if there's one trap there, and hopefully your back pain will slowly sort itself out. Again, you're not healing it, you're just helping facilitate the processes. And sometimes when you pull your back, it locks up tight as a safety, but it doesn't let go afterwards. And, so to try and just help the body get past that, acupuncture can be really good, or deep medical massage can be great. So, that's one example, like a musculoskeletal idea, but you could also take that further to lifestyle issues. There's certain, acupuncture points on the body that can help you sleep better, relax the mind, relax you, and really lower blood pressure, as do all therapies, really. If you go for therapy, you relax blood pressure and relax a person just generally. And I think it's good that I think you could get some, people might say, well, some of it's placebo effect. I'm not sure that matters. If it's doing the job, away you go. If someone comes and feels better afterwards, even if it's placebo to some extent, I'm not sure that really, that's an additional effect that you should look at. And there was a paper out in the NHS a couple of years ago, about 18 months ago now, that said 26% of all NHS operations are placebo because they're done incorrectly. So you go and see a consultant and he says you should do this operation. So he talks to the surgeon and says, I'd like you to do this. And some of them can be very complex, things you're trying to alter, very small things in the body, or tendons, ligaments, and you're trying to manipulate various things that consultant wants you to do. And the language and communication has got to be good because someone else is doing it. It can get a bit Chinese whispery. And sometimes things get missed. We're only human, and that's that. So people miss it, and the consultant will get the x-rays back and look at the report, and they'll go, no, he's not doing what I wanted him to do. He's missed it. But it doesn't say it's the client. The client walks in, and they go, how do you feel? And they go, I feel brilliant. And so you think, okay, that's fine. That's case closed on that one. So 26% of operations have those results. It is common not to get everything that a consultant wants to do and not to be totally successful in operations because they're extremely complex things. You've got time limits with people who are under anaesthetic for periods, and they don't always go smoothly. So you've got to do what you can where you can. So I think when you look at that, a placebo effect is a natural effect of optimism by most people in life, and I think some sort of change down there by cutting somebody open is like acupuncture. You stick a needle in or you cut them open, you get growth factors coming back and a wound healing response around the area that had the issue. So I think some of it, there's a doctor who's on a Horizon program, and he used to do shoulder operations for shoulder impingement. And so if you can't lift your shoulder, he used to go in and shave a little bit off the bone, and that was that. And he didn't see why these were working because it was such a small amount at times he was shaving off. So in the end, he just started cutting people open and sewing them back up and not doing anything. And they healed just exactly the same. So he was saying, well, partly it's placebo, isn't it? But there is a physical intervention going on as well. And I think that, you get those growth factors around the area it's got the issue, and that's what you're doing. You're doing micro damage, really. With surgery, of course, it's a bit more than micro damage, but with acupuncture and other tools, it's very small damage, and you get those growth factors and healing processes kick in that weren't kicking in around the area before, and suddenly you get the problem resolved. So, I think if you look at musculoskeletal, those sort of effects can come in. So, but with lifestyle issues like sleep and other things, there are acupuncture points as well that specifically relate to sleep and help people relax the mind and really balance the body out, if you want to, and get you back to more of a homeostasis. If the body's running at a very even state, then you should sleep pretty well. It's the imbalances of the problem. And then you can go right down to deep disease where you say, well, you've got kidney usage that's very low, 5% kidney usage, and you're on dialysis and things like that. And by using acupuncture or other techniques, herbal techniques as well, you can support the kidneys, bring them back and turn them back onto full function. And we've done it quite a few times now with kidney failures and other things. Liver failure is another one you can recover. And most science is agreeing now that you can, organs do regenerate and recover. They're now saying that the lungs, after, if you smoke 60 a day for 20 years, you'll need some time to recover from that. But they think that in about 15 years' time afterwards, you'll have absolutely brand new lungs. So, every organ is regenerating. And, the liver's one that quite easily can cut in half, and within sort of 6 to 8 weeks, it grows back to full size. And that wouldn't be, this should happen with all organs. We should be able to restart them, re-get them back, and get them to a place where they don't need any further treatment, because then you dealt with the cause. If you continue having to treat, you haven't resolved the issue. And you see this in lots of people will feel better and they've got much better than they were, but then they need maintenance treatments or, tablets to keep them, at a certain level. And really, you're resolving the symptoms. You're not really getting the cure all the way through. Some people come in my clinic, they'll say, oh, well, I used to play golf, but I pulled my back. But I've sorted that now. I've come back something else. And I'll say, do you play golf? And they say, well, no, not anymore. And I say, well, you've not resolved the back problem, then, have you? You've got it better to a point, but you haven't fixed it. If you fixed it, you'd have gone back to golf. So, and this is for me, when anyone comes in and they've got an issue, whether it's emotional, physical, or internal disease, and it prevents you from living life fully, then you've got a restriction on your life, and that needs to go back. You need to get your body as a multi-billion-dollar machine. You couldn't replace it. It will do all sorts of fantastic things, and I don't think some doctors and especially therapists don't believe that you can get things back when you can. I'm just going off digressing now, but there's a book called The Neijing, and one of the chapters at the bottom it says, if you don't think you're as good as if you don't think your acupuncture can fix the issue, it merely shows the state of your acupuncture. And I did, when I saw that, it really hit me hard that I had to go to fly to China and start really, because my acupuncture wasn't that good. I was turning clients away that I thought, well, I can't fix that. And it's actually, well, you can, but you've got to have, you've got to believe that. And secondly, you've got to have decent tools to be able to do it with. So, we've had all sorts of people come in with things that, they've been told, well, that's where you'll be for the rest of your life. And we changed. And that's all we're after, is changing the body. So, a bit of a long-winded answer, but hopefully you can see how perhaps TCM can have lots of different applications here.
Yeah, I'm astounded about what you're saying about kidney failure, and you say you've worked on a couple of these cases.
Well, I've had quite a few, yeah, and Michelle, who you know as well, from teletherapy, she's done a number of cases on it with the hospital, and they've done the test through all the way through. I've done blood tests. I've even done it on, we started this project on the kidneys on my cat that had kidney failure and had 3 days left to live, and so they did blood tests, confirmed it was true, and that she hadn't got long to live, and so we restarted the kidneys. So I spent all night trying to get the kidneys restarted, and with certain protocols managed to do it, and took him to the vet 3 days later, and he said, well, the kidneys are restarted, that can't happen. And it's like, well, it can happen. In Chinese medicine, they expect that's a normal thing to some extent. It can happen. Everything's reversible. But if everything's energy, and I don't want to get off that it's, some people listening to this will be very scientific, but really you have to understand that everything is energetic at some point. All the energy in the body goes through. You can measure that energy, whether it's electrical or, various types of chemical energies that come off people. And we're all energetic. And if you've got a certain wavelength of negative energy that the body's trying to fight against, if you can remove that and then repair that back out with another energy that's going the opposite way, there's no reason why you couldn't heal everything. And that's where people need to understand and get to, that everything is repairable. The problem is, do you have time to do it? When people are in really bad ways or have bad disease, they usually have a time limit on how long you've got before they're going to die. So, terminal disease and that, you've got problems. And it's whether you've got the time to do certain things. And there's certainly a time and place to go cutting people open and pulling things out. If you need to try and cut out cancers or other things, then there's a time to go do that. And I think, with therapists, I always try and tell them to meet the disease at the level it is. If it's energetic, meet it there. If it's physical, you've got to sort of start meeting it there. If it's physically internal, and at some point, you need to get physically involved if it's really become very physical, and the time is against you, I think. So I think there's a time and place for all sorts of medicine, and certainly in China, there's this thing where there's Western medicine and Eastern. They're in the same hospital, and both doctors have a crossover of training. And so they're quite happy to pass, to say, oh, well, you need to go and see this person about herbs. So you go and see this person about herbs in the hospital. They'll give you some herbs. These will help with, the tablets and things we're giving you. So, I think we just need to go back to actually doing proper medicine. And I'm not sure doctors are given the chance. Certainly GPs aren't, I don't think, given the chance to do proper medicine where they're actually healing clients and giving proper medical advice to them. I think a lot of the protocols are written by the pharmaceuticals industry, and so they're rolled out that way. And of course, if a tablet's a quick fix and it works, why would you not use it? Definitely, let's have it. But at the same time, if it's just going to be, well, you need to be on this for 30 years, that's not really a solution. We need to look at other things much deeper than that, and the side effects that you're getting from some of the medications. One of my clients had a side effect of death. It's like, well, it's not really a side effect, is it? That's, as the list of side effects at the bottom, it says, possible death. I'm not sure how, if Hippocrates, who talked about medicine hugely, and, doctors still do the Hippocratic oath of, behind that, and ethics are still built on Hippocrates' thoughts and processes of do no harm. I think when you sort of say on some of the medications it's going to cause you death, that's not really following the Hippocratic oath or the ideas of do no harm. I think that needs looking at. But I don't want to get onto big pharma and other things like that. We'll stay on the TCM side of things. But I think we just need to look deep and go back a little bit, as TCM hasn't done. Hasn't stays with it. It looks at the cause and it tries to resolve it there.
Yeah. I'm liking the idea of it more and more as you're speaking. I'd rather go and have some needles put into wherever it needs to go than be cut open under anaesthetic. If it's going to have the same kind of effect, if it's a placebo operation, shall we say.
I think there's placebo and everything, but acupuncture has now been measured so many times. There's so many papers, and it's certainly some of the lower effects of blood supply, turning off C nerves for pain. So you're getting some pain relief. It's been accepted now. by the NHS as, fantastic for pain relief. And it's one of the key things they're using it for now. NICE has recommended it last year. So that's, there's lots of evidence coming through. And unfortunately, it's just coming through a bit slow, and we're slowly working through where actually potentially all this is correct. We're about halfway through the whole procedure, and lots of things that have been said about acupuncture have come true, and plenty of doctors and nurses, do carry out acupuncture, physios as well. There's about 12,000 physios in the UK that do acupuncture. There's lots of doctors and nurses doing other internal medicine because they believe that the drugs, all drugs have a side effect, as one surgeon said to me, and that's the downside. You've always got some side effect, where with general complementary or holistic treatments, they do complement each other. You can use them all together, all differently, and they don't have an effect on each other that is damaging to the client. There are no side effects, pretty much. So,
because my next question is going to be, what is the difference between Eastern and Western medicine? Does that follow on with what you were just saying?
Yeah, well, I suppose we've covered a few different things about perhaps causes and symptoms. Western medicine perhaps goes for symptoms. I think that that's probably the key issue, is that we're trying to do symptoms with Western medicine. So someone comes in, if we look at internal disease, someone comes in with perhaps diabetes and issues like that, or asthma. You're trying to get rid of those symptoms and get them onto a healthy lifestyle. And ideally, you're hoping that the body, especially when people are young and they've perhaps got asthma, and you can give them an inhaler or something to help when they're having real problems, so that it's not a threat to their life. They're not going to, their lungs are going to open up and still work for them under stressful situations or exercise or things where they can do that. It's going to make their life much safer. But you're also hoping that they grow out of it, with young people. You're hoping that, well, this is, a growing issue. It's quite common for there to be imbalances when kids grow up and have all sorts of various things. And later on in life, most things settle down and people are much better. Lots of kids have acne, and then later on that settles down. Well, that's just a heat issue in the body. Kids burn very hot. There's a lot of growth and a lot of hormones going on. So, but later on, most people, do sort of calm down, the skin calms down. Asthma tends to, go a bit softer than people lose inhalers, or they may still have them around, but, they tend to, if you ask them where it is, they probably take a few minutes to find it, which isn't ideal if they had some sort of attack, but, they use them so little as to grow out of it. And I think that's what perhaps some of medicine wants to do, is take these painkillers or do this and come back and see me in a few weeks if it's still going on, because hopefully you'll get past this issue in your life or this imbalance, and your body will bring you back to homeostasis and everything will be fine. Unfortunately, that a lot of the time doesn't happen because the external circumstances don't change. So if the diet doesn't change and it's a dietary issue that's causing the problem, then obviously that's not going to change. And that's, I think, where doctors need to step up and take some responsibility and learn those sort of 5 areas and say, right, let's look at the cause, because again, a doctor might identify the cause perfectly well. And sometimes in Western medicine can identify a cause, but you have to say, well, that wasn't there before. Where's it come from? You've got to be a bit of a detective. You've got to get in there and you've got to understand what is going on. So I think that's probably the number one thing that doesn't just separate TCM, but I think holistic therapies generally, although TCM, because of its age and because there's been so much observation and the fact that they can retry things again and again with hundreds of thousands of patients over several thousand years, the application and the extent of it is huge. If you think about 2,000 years ago, what were we writing down? Well, we were scrabbling around in the mud a lot. We weren't doing a lot. So where there was a whole culture set up in education, and people were allowed to explore and study nature and study the flow of in Taoism, as they call it, and to try and see the changes that are going on in life and what caused those changes, so you get a better understanding. And I think that's useful to sit back and observe and make really good quality observations over a long period of time of people's health. I think you start having a much deeper understanding of it. And, if we look at people's health generally, we're doing a 2-week, look at it, or 2-week trial and clinical drugs. And, if you look at side effects, any side effect sheet that's written is a sheet of everything that's happened during the clinical trial. So if it's a possible death, well, someone died on the trial, or possibly died and was, resuscitated. So there are all the things on the sheets that you see on those drugs actually happened on the trials. They have to put them down once they happen that trial. So they try and pick the people for the trials very carefully to keep those to a minimum. And I think, again, it's this idea of, do no harm. I think we need to go back to something more, finding the cause, being very specific about treatment, where if you've got people on diabetes, for instance, there are a range of people with lots of different ways diabetes could be caused within their body. It could be diet if it's type 2, there are genetics if it's type 1, but there are other causes and other stresses and other things that could be helping that and accelerating that. I think without us understanding those or trying to even look at those, one tablet for every diabetic person is not going to be the right match. And, this is why some doctors say, well, the medication is not working, we'll change you to a different medication. Because no one's really written down or understood, well, this medication works very well for these type of people. And this medication is brilliant for people that, can't sleep and have diabetes or whatever it is, or have diabetes from a diet. And I think we need to be more specific about our medications if we're going to take the Western route. And there's nothing wrong with, herbs, Chinese herbs, you argue are drugs. There are drugs, they're from a natural place, but so most Western drugs have come from natural circumstances and then been sort of developed because of those properties, and then synthetically developed further to try and use some of those chemical properties. So, Chinese drugs are the same, but there's a much more deep understanding of conflicting of drugs, and people specialize in Chinese herbs to understand every little change that they make and what effect that would have on the person and the overall treatment. I'm not sure doctors, understand the amount of drugs that are out there and the conflicts. And it's often that I see clients that are on drugs where they're on 2 drugs, and what he says, in the British National Formulary, which is one of the books that doctors can use, that the 2 drugs shouldn't be prescribed together, and it could cause heart palpitations and heart attack over time. And yet you'll see lots of clients that they do have multiple medications that are conflicting with each other there. And because it's a very complex subject, and if you've got 7 minutes in the doctor's surgery he's got to give you this and try and work out if it's going to be okay, he'll make a judgment on best knowledge, and that's that. There's a lot of blame going for doctors, and I'm not sure it's their fault. I think it's the system that needs really reviewing, and I think it's doctors where that needs to come from, though. That's the problem. If doctors don't stand up and go for that change, then it'll never happen. So, I think that's where the thing is that Chinese medicine looks for the cause and tries to heal the body, tries to get that change in the body and then allow the body to heal itself, as opposed to trying to force it by drugs or other uses.
Wow. So in that case then, could like acupuncture or whatnot, in some cases, replace the use of Western drugs for health issues?
I think the answer is definitely. People are shouting this when they hear this now, say no, drugs do have a place, and they do have a place. But I think if you sort the cause out, which acupuncture or whatever therapy is great at, if you can get to the cause. So say you've got a liver issue, then the liver's overworking, that will create a lot of heat, and that's going to dry up your fluids, and it's going to cause a very acidic environment. If you remove the fluids and you start adding heat into the system, you can end up with a carbon dioxide based environment that's very acidic. And that's, cancer loves a carbon dioxide based acidic environment. It's going to stay in that place. And if you've got heat thickening the fluids, you don't get good movement around the body. The blood doesn't move as well. Everything's a bit thicker and a bit more what Chinese would call phlegmy. It starts clogging up the works a little bit. Then you're not getting good movement. Cancer loves that sort of environment. And when doctors say, oh, you've got a very aggressive type of cancer, you have to remember that doesn't exist. There isn't such a thing as an aggressive type of cancer. If you catch cancer, you have put your body in a state where cancer can exist. Yeah? And that's you. Everything in your life is your fault. Your responsibility. The emotional therapy idea, you have done that. So you need to change that environment. And you need to make it an environment that cancer cannot exist, or you at least, if it does exist, it can't really grow very well, and it's the worst case scenario for cancer. It's the worst environment to put it in, So if you go and get an elephant, you put it in Antarctica, it's probably not going to last very long. It's used to humidity and heat and other things. It's not going to do well. Same thing if you can do that with cancers, So the person themselves has put them in this state, and we need to understand that actually if you have an aggressive cancer, it just means that state is really perfect for cancers. That's why it's aggressive. That's why it's growing very quickly. And we need to change that state so it becomes very slowly or no growth at all, and it holds. And potentially, if you're in more alkaline systems, you can, hopefully it kills it off and reduces it. You do get people making massive changes with a form of cancer, and a lot of times doctors do say, "Oh, actually, it is reducing." Because of the changes you've made, and that's because it's generally you've swapped the environment and you made it so bad that it can't survive in that environment. And so, I think, when you're looking at acupuncture, let's say, go back to the scenario, the liver's overworking, creating this heat and all these items, if you can pull that liver from overworking, pull it down to its normal rates, instead of being hyper, you bring it back down to a normal biostasis in the body, then I think, you then don't need the drugs, because the drugs are treating the symptom of what the liver's doing. They're not treating the liver directly, because we don't look at that as the cause. So I think acupuncture can, but at the same time, I think, again, Western medicines and herbal medicines, they are very similar, a lot of crossovers, and they need to be used for the right thing, as with everything. I think to stick a needle in somebody, you need to have a very good reason to stick a needle in somebody, that it must be doing something really effective. Don't just put one in for the sake of it, put a few needles in and hope, that's no good. We need to really have a good understanding. And I think with medicines, the understanding, if it's, as I say, if it's a disease, if it's like an external pathogen you caught, and you can have something inside of you that helps kill it off much quicker, like with malaria and that, there's great drugs for malaria and other things. Well, great. If you can kill it off really fast with those drugs, why would you not have them? They're brilliant. And any drug for a short period of time, it doesn't really matter too much about the side effects to some extent, unless you've got a real big issue, weakness in the body, or, you're very frail and weak. You should be able to have that. It gets rid of the problem, and great. It's a really quick fix. And so you can look at drugs that are very attractive to use, because if they do what they say on the tin and they fix the item, then there's no concern from anybody, is there? And we should, to some extent, some drugs we should be singing and dancing around saying this is brilliant. But the ones that are really great are the ones that we really understand and say this is used specifically for this item, and it's very good at that. There's a drug called amitriptyline, which is a very strong drug, was brought out as an antidepressant, but actually now they've found is better as a nerve blocker for nerve pain. And so 10, maybe up to 30 milligrams is great for blocking nerve pain. And, if you pull your back or you've got a trapped nerve, you can't move. It's so painful, so just totally debilitates you. You can't work, can't do anything. You don't move because you don't want to cause it again. And getting sleep, if you've not slept for 2 weeks, or you've got 10 minutes sleep every night for 2 weeks, you soon start thinking about, killing yourself. Or, you don't, but, you still start thinking of anything to just, it's better than this. This is not life. And to have a drug like that that allows you to sleep all the way through the night is just life-changing. But of course, you don't want to be on that for 20 years. That's not a solution. You need to solve the nerve pain and get rid of the problem. So I think that's, I think definitely acupuncture, Chinese medicine, and other therapies, of course, that are out there. There's traditional English herbal remedies as well, which are brilliant. You can resolve lots of causes, and therefore you don't need the other drugs. I think the problem comes, like we said earlier on, that when time is against you, you need to be more and more invasive. And if you look at things like chemotherapy, they are trying to kill off either you or the disease. They're trying to kill off cancer, and if you're strong enough, hopefully you'll live. But it's going to take it almost where you're dead, where you're putting the body in such a weak position, there's nothing for the cancer to live off, and so it dies. And you're hitting it with very toxic, very accurately toxic, putting in a toxic environment for it. But you also, of course, putting a human being in a toxic environment. You could argue, again, that's do no harm, that's totally conflicting. That's not a medicine, is it? However, the argument against that would be, well, time. We haven't got the time to perhaps work on what drugs might work here, or long term, you might be able to solve that in 3 years, with various treatments and, looking at causes and other things, changing lifestyle. But if they've only got 3 months to live, that's no use to them. You've got to get in there. So I think that definitely there can be other therapies can remove the need for drugs entirely. But that's a very simple statement on its own, outlined in it. And, I can understand someone immediately arguing against that from a point of view of a medical expert or doctor saying, well, that's not quite true. If the time is against you, I say you need to get more physical. You need to start really doing things that may not help the client, but actually you do manage to save their life. So you need to get more involved. And really, if you want to solve the issue, you could argue that actually the client needs to take responsibility, and socially we need to be educating people on what their food choices are, what their lifestyle is. We need to be promoting a lifestyle where people are happier in life. Denmark's voted as the best country to live in from people who, who's been there and lived there, because they say it's the happiest, country. Okinawa is not far off and has a very much healthy lifestyle and has the highest age for population anywhere. So I think when you look at those things, you've got to sort of change the way we work, change the way we have attitudes to things. And, I say big pharma, I think, as obviously there's billions of pounds worth of business there. So there are certainly undercurrents and undertones controlling what people do on that. But big food is just the same thing. It's if you sold a product that definitely caused thickening of the arteries and eventually will give you a heart attack, and you put that on the label, the government will ban it, or they would try and limit it, as with cigarettes, and say this is what's going to happen to you. You don't see that on fast food and other foods that are going to do damage. But that's exactly what's happening. And when people understand, actually, I put myself in here, like diabetes type 2. I'll say something quite controversial now. Diabetes type 2, is a self-inflicted disease. You've put your body in a state where you've had so many sugars and carbohydrates and basically low level sugars that, you're having blood sugar issues and you've got diabetes type 2. We can reverse that, proven. We've done this in about 43 days. We can get down to 28. And now hospitals have done it in 11 days and reversed it entirely. So it's not a factual thing anymore. It's not like a nice idea of, oh, you might be able to. It's just 11 days they've done it. And we would say we took a bit longer because we're not being as sort of drastic as the hospitals are in some occasions. So you can remove diabetes type 2 entirely and take it backwards. So it was your choice. It was your external cause that you put into the body that then did the damage. And I think the education of the population and also remodeling of our social environment really is important to us, especially, just to go subject to it on drugs and drug taking. It's the environment that causes people to take drugs, because the drugs facilitate the removal of the pain, whether it's alcohol, or stronger drugs. That's what people are doing. If you change the environment, people come off drugs anyway. They're not addicted as people perhaps think they are. They can come off them quite perfectly well if you take them out of the environment that they're in. So it's the environment that we need to change, and education of people, I think.
I love it. I love it.
Sorry, I've gone on there. I'll listen all over the place. You had one question.
No, it's fine. Okay, thank you for that. Chris, let's talk about you a little bit now. How did you get into traditional Chinese medicine, and why?
I've always been interested in healing. I don't know why. I remember my grandma saying when I was about 3.5, 4 years old that I pointed at someone who couldn't walk very well and said, wouldn't it be great to be able to heal them? And so there's always been this thing in my life where I've been looking for it. And I've gone off and done other jobs, and I've got IT companies and sold those and done things. I've worked all over the world doing various things, and this was always in the background there. And then I came across a Chinese doctor, because I did some Swedish massage and other things, and not really for money, but just help people out. And I was interested in the subject. And then I came across a Chinese doctor I'm very grateful for, and Master Chu, and he really explained a lot of things, and it was hard for him to explain because he didn't speak much English and I didn't speak much Chinese. So we managed to muddle through, and he had some patience, and he would show things, and and there I saw Trina medical massage. I wanted to learn more about that. I went to the UK and learned more about that off other people, and then thought, I'm not getting the real thing here, and sometimes you don't always get the most authentic treatments. And in the end, I had to, after studying and doing various things, I went to China and just got on a plane and think, right, that's where I'm going. So it was China and Japan. I went to Japan because I had links there already, and I'd done some internal acupuncture, acupressure, if you want to call it that. My father was a very highly graded jiu-jitsu person, and he also knew where to hit people on acupuncture points to knock them out and do various things. So I'd learned acupuncture points almost in a different way, and then I wanted to know more about them. So when I was in Japan, I came across more people, and in China before that, really I found out that things in China had changed massively since Mao Zedong, probably around 1935, and so before that, acupuncture of family or traditional medicine was done totally differently, really, and there were a lot of changes and a lot of things altered and things taken out because they weren't sort of on the roadmap of where modern China was going. So a lot of people left or had to leave because they were going to be locked up and practicing various things, and so they went to Taiwan and Singapore. So I managed to get some letters of introduction and went to Taiwan and studied there, and really that's where I really saw the real deal, and saw what it really could do, and that everything really is possible. You can change anything back. It does take hard work. It takes, you've got to be a detective and find the cause at times, which is often hidden away if someone's got lots of things going wrong with them. But when they come in, they're very ill. There's so many symptoms and so many causes. Sorting out what the original one was can be a problem. And of course, the external cause, you've got to get clients to change that. And a lot of them won't change their external life too much. So, if someone's got not long to live, you need very big change. And clients aren't always willing to do that. They're almost, especially if they've been to Western medicine, which might say you've got 6 months left to live, they come to the conclusion that that's true. And therefore, they're not really going to consider then fighting through that because they just don't believe that they could live any longer. So you've got to change those ideas. But in China, they'll treat everything, looking at energetically and how you can balance things and how you can move energy in the body. And, energy is a bit of an odd word because people, want to physically see things, but, just scientifically, everything is energetic in the body. That's the way it is. Everything in the universe is energetic. That's just standard quantum physics. And there is this balancing that the body wants to try and create, where as soon as you get an imbalance on one side, the body's trying to immediately counter on the seesaw, if you want, on the other side. As things come in, it gets harder and harder. But in Chinese medicine, there's so many different ways so many different treatments you can throw at it, and in so many different ways that you can be really clever with it and really, help the body get past something. So that's really, I was drawn to that and had to go and see the originals, and was very lucky to have some fantastic mentors. I've been very lucky in life to have, really great mentors that have really seen something in me that I didn't, as you never do, I don't think so sometimes, but really drew things out of me and gave the time so much time kindly and carefully, and put so much into me that I'm really grateful for that journey. So my job here is really to try and bring that back in an authentic way, and to convince the people, therapists especially, that they can go and do this, they can recover things, and that to try and change the landscape of where we are with disease, especially as most Western diseases don't exist anywhere else in the world, and that's an important thing to understand. They don't. If you look at there was a study done in Africa on diseases and other things, and there were doctors out there that were doing all sorts of really helping the people there with various issues that they had with Western medicine. But they found that there wasn't a single case in 7 years of heart disease, and to not have a single case ever, it's like, well, that's a Western disease then, isn't it? That's a Western environment, and a lot of the diseases we see, if you go back 40, 50 years, they just didn't exist, or some people might argue, well, they did exist, but we didn't sort of diagnose them as well, so we didn't know what they were. But you'll find that actually, no, they just didn't exist. There's a possibility of a small number that perhaps were, but the percentages were really low, And you find a lot of it has come out because our modern lifestyle just isn't matching up to what our body needs anymore. And our body hasn't got time to cope and change with that. It takes a long time to go through that. So hopefully I can bring these things back. And, we're licensed from Japan and China. I'm licensed outside from there for teaching and things. And it's I just try and transfer this knowledge across, and really that's my journey up till now, really, which I'm trying to proceed with and expand and get more people doing it.
Wow. So you're like on a one-man mission, aren't you? To sort of like,
I am.
How did you come to this point in practice and teaching then? What was it?
I don't know. I'd never really wanted to teach. I wasn't ever thinking of teaching, but I started teaching martial arts under my father, and started to understand that when you teach, you've got to be quite concise and you've got to put things in a good frame, and that when people first come to learn something, they haven't learned how to learn. And it sounds an odd thing, but anyone that's a sports person will understand this quite well, that once they've learned a sport and they've learned the basics of how to learn, take knowledge in, an instructor can show them something and they can pick that new item up very quickly because they've learned how to learn. They've learned how to take the information and add it up. And then they can go to a totally new art. So like someone can go to get on a horse and say, well, I'm going to have horse riding lessons. And the person will say something like, have you ever ridden before? Because you're picking this up really quick. Well, because they're a sports person, they've learned how to learn. They don't have to do that beginning bit. And I was really interested in that and education and how that could further people. And some of my father's ideas were quite good, that he was always saying, look, if I can pass on everything I know to you at an earlier age, if I can pass on 72 years worth of knowledge back to you by the time you're 35, then you've got 35 years to do this, to add on to that knowledge, and then we duplicate that again and again, and that pushes the world forward. So there's those ideas that I sort of wanted to put across, and because I trained in quite authentic things or ideas, and in Japan, they're very conceptual. They look for conceptual ideas. So there's no point teaching something that works here but doesn't work there. It makes too many rules, and they're very hard to follow, and there's too many complications. So they try and they sit back and oversee something over 50, 100 years and try and make a conceptual idea that here's the concept that overrules this thing. And that really interests me in education. Can you pass on a concept to people in Chinese medicine where they understand the concept, and because of that, they understand the rules of the game, that you can't break this concept. You must, if you break the rules of it, you're not going to do well. But if you continue with the rules, you'll get really good treatments and really good, care for your clients. And so it really came about through experimenting with these ideas that people put in my head about how life could be and how thought processes could be. And then I just started, people asked me to teach, Michelle, from Total Therapy, she, asked me to teach her and a few other people. And we just did some classes, and I spoke to Japan and asked them for the licenses for teaching, and they said, no, not really. And they said, well, Swedish, Chris, go and prove you can do a Swedish class. So I had to do Swedish and teach everyone Swedish, go through it, prove the class, and all the whole layout of it. And then they sort of said, okay, you can do a small trial with cupping. So that was our first course we started. Unfortunately, our cupping, we know lots of things about cupping and the traditional way of doing cupping that most people in the UK don't. Cupping's a fairly simple art to some extent, but there's a lot of tweaks in it, and there's a lot of really good tips you can really change your treatments with. And so we did that, and we got a really good name for that. And then they started saying, oh, you're going somewhere with this, we'll start giving you a few more, but it's probably taken almost 10 years to get full trust, where they said, right, what do you want next? And they've actually opened their secret doors to all sorts of knowledge they've had there hidden away, which, is now we can go out and teach. So we've got lots of expansion on things that we want to really put out there now. So that's the journey and where we're up to so far, I think.
Because I'm going to ask you now, what do you offer people through the Total Therapy and other groups that you teach with? But it sounds like to me that you've got like a secret door into Japan? Like, so is anybody else doing this kind of thing, or is it just your?
Well, yeah, lots of people have gone over, do go over, especially Japanese acupuncturists go to Japan and study and really learn the depth of the art. And Chinese people, as well. Of course, you've got a lot of Chinese doctors that come over here who've had really, who do understand the culture already, don't have to learn that, and so have a great depth of Chinese medicine. I think there's a difference between perhaps modern Chinese medicine and the traditional old. If you go back perhaps 80, 90 years, it's totally changed a lot. And I think there's a lot to learn from the old traditions that may not be being taught these days. So, there are people doing it. I think it's just about, for me, I always want to get, I think it's, to be very direct, to be honest with you, I think it's because of an insecurity of mine. I think I've got an issue that, I think when I was younger, I had a little bit of, not lack of self-worth, but doubts about who I was and what I could do, my abilities in life maybe. And I knew I was capable. I knew that I didn't, I needed, I wanted to get it right. Because the worst thing that could ever happen is to do something and someone, say, well, that's totally wrong. Then I go, oh, right, I don't know what I'm doing. To look a fool, I suppose, was an insecurity as a child, or as a teenager, I didn't really want. So that made me make sure I get things right. So I ask, if I'm ever training, I ask a lot of questions. I want to understand it inside out, and I want to make sure I get it right so that I can pass that information on correctly, but also for my clients so that I do the right thing and I am correct at what I do. And that's in everything. I like to understand. If I understand the subject, I pretty much understand it very, very deeply, very well. And then there's other subjects I've got no clue on at all because I don't want to go into and partially understand them, So it's, if you ask me something, I say I know. I probably know it fairly well, but other things that are like that. So I think there's that. I wanted to get this right, and I was passing on. I had responsibilities to Japan and China, the school in China, the legacies that were there, to make sure other people got this and got it how it was, and that was really important for me to be able to pass it on so that it's an ongoing tradition. The problem is things can get watered down. If you look at Swedish massage, where I started, which is, a nice, respectful, relaxing massage, but doesn't really solve many problems. And that was where I felt I needed to learn other things. It's not a sports massage. It's not for injuries. It's not for other things. It's a general massage. That type of massage just doesn't exist in the Eastern. People don't go for relaxing massages. They go for maintenance, definitely, but it's maintenance of the body. Where there's an issue, you get in there and you find out what it is and you tweak it. And they're quite hard and quite brutal at times. You get in there and let's get rid of the problem, because leaving it there isn't a solution. Where if you say to a Swedish person, oh, that really hurts on my shoulder, they'll leave the whole shoulder out and go elsewhere. And it's like, well, it still hurts afterwards. You've not solved the issue, So I think some of these, in the West, we have taken things out because they're easy, we've made them simpler, we've watered them down, but then you lose the benefits behind that. And I think hopefully some of my work can help bring back some of those benefits and other people's. There's so many beautiful, brilliant people who really are invested in this, trying to bring back the authenticity of things. And I think that medicine is slowly making a change, partly because some of the doctors feel that they're not perhaps doing the best job that they could, or they're not being able to. It's not them, it's the system isn't enabling them to. And also I think patients want choice. They want to start choosing other things. They realise that drugs aren't always the best way for them, and that they realise they don't want to be on drugs for 20 years, for the rest of their life. That's not a solution. So they are looking for other things. And I think if we can all come together to do that, and my job is to facilitate as many therapists or as many clients as possible to get to that point, then we can really make, change within the world. And that's what we all need, is change.
Yeah. Wow. So what do you offer for people through Total Therapy and the other groups that you teach with? What is it? What is your...
Well, obviously, usually I'm asked to teach for various groups around the world. I've taught in LA and America and Cyprus, and it's I'm just trying to put across the information really well to facilitate these people learning, and so hopefully they have a better therapeutic understanding of what they're doing. And I try and put the passion in so that I enliven people who are just therapists into actually pushing and really going further with their own things they've learned, but also hopefully some Chinese therapies as well, so they can, use the tools. I think as a therapist, you need a big bag, a big toolbox full of different tools. It doesn't mean one thing won't help, But I think each tool, like with the drugs, drugs can be fine for very specific things and really good, and we can't do without. Some of them are just fantastic. We should appreciate that. But there are certain tools as well in complementary therapy that are great for a certain specific job. But outside of that, they're not the be all and end all. And unfortunately, I think it's quite a human thing to go down and develop something. You think, this is great, I'm getting fantastic results, this one thing. And then you sort of at the end of a road, you want to expand it and see what else it can do. But by going there, it doesn't do everything. Nothing can ever do everything. The way acupuncture is done is very good. It's very flexible. It can do so many different things. But there are still things better than acupuncture. If it's musculoskeletal, tweeing and medical massage has been proven far more effective than acupuncture, although acupuncture is great for musculoskeletal. But it's, I think you can combine them in one treatment as well. I think you can pull them together. So with my clients that come to see me for treatments, you probably won't get one treatment. You probably end up, I had someone last night, a guy came in, he could hardly walk in, he pulled his back. His wife was with him, who I know fairly well, and she comes for treatments, and he doesn't believe in any of this, so getting him here, he must be in pain, for him is the last resort sort of thing. So we got him on the bed, we did some neuromuscular release, we did some what's called gua sha or scraping, because it increased the blood supply hugely. We did some acupuncture on his back, we checked all the points, we worked all the way around, and we did chiropractic manipulation as well. We did a few other bits, and then we were a good hour and 10 maybe, and he got off the bed, and he actually cried to his wife because the pain had gone. He felt so different than he was that he actually cried, and his wife hugged him, and just because it's so debilitating, back pain. If you've ever had you just cannot, you're so scared of moving an inch in case that nerve gets twinged and grabs you. So, and I've been exactly where he's been myself with back pain, so I understand it entirely how he was feeling. But that sort of response is like, well, what's that worth to me? That's to be able to do that for somebody and change their life in that way, where they can function again and go back and have a fulfilled life. What more? Yeah. I'm doing my job, I think, and I don't need to ask much of the universe apart from send me more of those, and I'll get on and let's do it. Hopefully I'm fulfilling what I'm here to do, and that's the key thing is, I think, in life. So that's what I do with clients, and say what I do with students, to try and take them to a new place, try and get to think differently, think more broadly, think that they can do anything. No matter what treatment they're doing, that they can do more than perhaps thinking they could. And help everyone find their path of fulfillment, I think, is important as well. Facilitate that.
All right, lastly then, Chris, how can the listeners get involved with learning and practicing traditional Chinese medicine?
Well, they can... obviously there's lots of practitioners around. If you want to practice, they can look at the British Acupuncture Federation and look at organisations there if they want to find therapists near them. There's obviously lots of clinics around there's total therapy as well, which is near me, and obviously we do lots of teaching there. So there's total therapy training, which is great. There's also the college I teach at EMA and a few others through the UK. So I think the best thing to do is perhaps get in touch with some of these groups and see exactly, look at the range of courses and see what you need to do. You can get in touch with me if you want to. I don't know whether to do it through you or here, or through email, or so you can contact me if you want. My email, if you want direct email, to me, be Chris at firstcorp.co.uk. One of my old IT companies I sold off years ago, but still use email. So you can contact me on there directly. But look at the Total Therapy training site. They've got a lot of training, a lot of authentic things you don't see elsewhere, and the level of the instructors there is really good and really authentically training, going back as well, like back to China and Japan, where you get licensed as well. So that's probably one of the places. But British Acupuncture Federation is, again, 8 fantastic organisations on there. Most of them do training in various things. So if you want to expand down that road, and of course on the emotional side, I've done a lot of emotional different therapies, but for me, it's the foundation of emotional therapies, counselling in Cheltenham, or the FETC, which you can look up. They are just fantastic at training for really getting like Chinese medicine, getting to the core issue and resolving it very quickly and trying to understand it, and trying to understand putting preventative items, as you'll know off the first course, trying to understand the cascade of issues that can happen in mental health and why they happened, and change them from ever happening again, so you empower the person and then they don't need you anymore, which is the ideal situation. I sometimes say to my clients, if I don't ever see you ever again, I hope everything goes all right and that. But obviously, if they ring me, they only ring me because something's gone wrong. They ring me up, and sometimes I'll pick up the phone and I'll say, "Are you okay?" And I go, "Sorry, stupid question, because you rung me because it's not okay. You need your back fixed, or you need whatever." So it's in a way, I think it's, again, we can all facilitate people so they don't need us. That's our key aim.
Make yourself redundant.
Yeah. Absolutely. Well, then I can get on with other things where I'm needed. That's it. And I think that's the trouble. I think some people are scared of that, aren't they? Some people like to keep people on maintenance and not perhaps fixing them, and other people, pharmaceutical drugs. You don't want to fix somebody in 2 weeks. If you've got a brilliant drug, you'd rather have to take it every day for the rest of your life, wouldn't you? That's an ideal drug for you. But I think there's a lack of understanding that once you cure this, you're just on to the next thing, and then you can go and cure something else, and you can work through these things. And I think that's a better way of doing it, and makes people, as I say, certainly from my point of view, the idea is to people shouldn't be a crutch on me for their back or their mental health or whatever it is. It's allowing them to really find themselves and enable themselves to change the external circumstances so they don't get a problem again, whatever those external circumstances are, but also so that they do, find also a way to facilitate it so that they fulfill themselves in life. And I think that really is what I class myself as, not a healer or not an acupuncturist or mental health worker, but it's more a facilitator. That's what I class myself as my job.
Brilliant. Well, thank you so much for your wealth of information. Just sat here reeling from it and taking it all in. Thank you so much for joining us today, Chris. Is there anything else you'd like to share with the listeners before we...
No, I think I've said enough. I think I've taken up too much of your time and said far too much. So I could probably answer the questions much shorter now, but anyway.
You've been listening to a Total Therapy Training podcast, where you've joined me, Sarah, on my journey through traditional Chinese medicine. We hope you enjoyed the show, and we hope to see you next time for even more incredible information.